So today my patient is a baby doll, so whatever I can't do on her, I will verbalize or do on myself. Thank you. I'm going to perform an hygiene. Hello, my name is Jenna and I'm going to be your nurse today. How are you feeling today? Okay, are you in any pain? Okay, so today I'm just going to be doing a full head to toe assessment. And at points of this exam, I'm going to have to touch you. Is that okay? And the patient agrees that's okay. So can you state your name and date of birth? Okay, and do you know where you are right now? Okay, and do you know what date it is? So my patient is alert and oriented ×3. I'm going to go ahead and note that my patient's attire is appropriate for the setting. She appears well nourished, well cared for. She maintains eye contact. She's sitting comfortably erect. She appears calm, cooperative, and relaxed. She follows commands appropriately, and when she speaks to me, her speech is clear and coherent. So the patient denied any pain, her vital signs are stable, and her BMI was assessed, and it is adequate for her height and weight. So now I'm going to go ahead and assess the skin. So upon inspection, the skin is pink. I don't see any bruises, no freckling, no rashes, lesions, lumps, bumps, anything like that. So now I'm going to go ahead and palpate. I'm going to feel with the dorsal surfaces of my hands for the temperature. Okay, so this patient's skin is warm and dry. Now I'm going to assess skin turgor. So I'm going to pinch a little bit of the neck very lightly, and the skin is mobile and there's no tenting. Alright, now I'm going to assess the nails. So the nail beds are translucent, the edges are smooth, the nails appear clean and well approximated. The contour is less than 160 degrees, which tells me that there is no clubbing, and cap refill is less than 2 seconds. Okay, so now I'm going to move on to the hair. So my patient has reddish colored hair. I'm just going to go and touch her head. There's no dryness, there's no dandruff, there's no flakes, there are no infestations. Her hair is red and it's shiny. It feels coarse and it's short and it's curly. Okay, so now I'm going to inspect the head. So the patient's head appears normocephalic. There are no gross deformities. There's no swelling, and her face appears symmetric. Her head appears symmetric. So I'm going to palpate her head for any masses, lumps, bumps. Do you feel any pain? And the patient denies pain. I'm going to look at the scalp. So it's a pinkish tone and the skin color is even. And there are no infestations. Okay, so now I'm going to move on to the face. So the patient's face is, her eyes, her nose, and her mouth are symmetric. And now I'm going to just palpate for the temporal arteries on both sides. Okay, and they are +2 bilaterally. And now I'm going to palpate the maxillary and frontal sinuses. Just tell me if you feel any pain. Okay, and the patient denies pain. So now I'm going to move on and I'm just going to assess cranial nerve 5, which is the trigeminal nerve, and I'm going to assess the motor portion of that first. So I'm going to ask the client to bite down, and I'm going to feel here where the temporal bone and the maxillary bone meet. And there is no crepitus, no stiffness. The client denies pain. Do you feel any pain? Client denies pain. And is equally strong on both sides. So I know that the motor portion of the trigeminal nerve is intact. So now I'm going to go ahead and assess the sensory portion of trigeminal nerve, or cranial nerve 5. So to do that, I'm just going to get something nice soft. So for this assessment, I would have my patient close her eyes and tell me where she feels sensation. So close your eyes, please. And so my patient would say forehead, left cheek, chin, right cheek. So sensation was felt bilaterally, which tells me that the sensory portion of trigeminal nerve, or cranial nerve 5, is intact. Okay, now we're going to move on. So now I'm going to assess cranial nerve 7, which is the facial nerve. So I'm going to have my patient smile. Okay, and now I'm going to have my patient frown. So her smile and frown were symmetrical, which tells me that cranial nerve 7, which is the facial nerve, is intact. So I'm going to move on right into the eyes. So the patient's, the palpebral fissures, the eyebrows, and the eyelashes they are symmetrical. The hair on them is evenly distributed, and I think I forgot to mention, but the hair on her head is also evenly distributed. And so now I'm just going to palpate the lacrimal apparatus in the punta. So tell me if you feel any pain or tenderness. And the patient did not report any pain or tenderness. Okay, so now I'm going to also assess the conjunctiva and the sclera. So I'm going to just pull my patient's eyelids down slightly. And the conjunctiva is moist and pink, and there is no drainage, and the sclera is white. So now I'm going to go ahead and assess cranial nerve 2, which is the optic nerve. So we already performed the visual acuity test. So it was determined the client has 20/20 vision, which means that from 20 feet away, the client can see what the normal eye can see at 20 feet. We're also going to be performing the confrontation test, which will test the client's peripheral vision. So I'm going to ask my patient to cover one eye and tell me when she sees my fingers. She should say now, 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 and now, and the other eye. She should say now, 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 and now. Okay? So my client's peripheral vision is intact, which means that the optic nerve, or cranial nerve 2, is intact. Okay, now we're going to assess cranial nerves 3, 4, and 6, which are the oculomotor, the trochlear, and the abducens. So in order to test these, I'm going to use my pen light. So looking at the client, I noticed that her pupils are equal and round. So now I'm going to check the reaction to light. So when I shine my pen light into the patient's left eye, her left pupil constricts directly and her right constricts consensually. So I'm going to test the other one. When I shine my light into the patient's right eye, her right eye constricts directly and her left consensually. So I know her eyes are equal and round and react to light, her pupils, and now I'm going to test her accommodation. So I'm going to ask her to focus on this object over my shoulder, and then focus on that right in front of her, and I'm noticing that her pupils constrict and converge, which means that her eyes accommodate. So her pupils are equal and round and react to light in accommodation. Okay, so now I'm going to check her extraocular movements. So I'm just going to test this using the 6 cardinal fields. So I'm just going to ask my patient to follow my pen light with just her eyes. Okay, here's 4, 5, 6. Okay, and so our extraocular movements are intact. Now we're going to move on to the ears. So looking at my patient's ears, I'm noticing that there's no redness, there's no swelling, there's no lumps or bumps or lesions, and there's no drainage, there are no foreign objects. So now I'm just going to palpate the auricle and the tragus. And do you feel any pain or tenderness? No pain and tenderness was reported. Now I'm just going to examine the ear canal. Okay, again, no redness, no lumps, bumps, erythema, no, I said redness and erythema, same thing. No lumps, bumps, no lesions, no drainage, and no foreign objects. So that's a good thing. So now we're going to assess cranial nerve 8, which is the acoustic nerve. So in order to do this, I'm going to ask my patient if she can cover one ear, and then where the other ear is, I'm going to whisper 3 words and ask her to repeat them to me. And the client should state red, orange, blue, because that's what I said. Okay, and the client should say twinkle, twinkle, little star, and I would know that acoustic nerve or cranial nerve 8 is intact. So now we're going to move on to the nose. So visualizing her nose, it appears symmetric. I don't see any lesions, I don't see any redness, I don't see any bumps. Now I'm going to inspect her nose. So the nasal septum, there's no deviation. And the turbinates, the nasal mucosa, are moist and pink. I don't see any lesions or bumps. Okay. So now I'm going to just assess cranial nerve number 1, which is olfactory. So to do this, then you need to smell. Okay. So this will test the patency of her airway. So I'm going to ask her to close one nostril and sniff and tell me what she smells. So close your eyes. Okay, and she should say cinnamon, because this is cinnamon. And then switch nostrils and smell. Okay, and she should say coffee. So now I know that cranial nerve 1, or the olfactory nerve, is intact. So now I'm going to move on to the mouth. Okay, so upon inspection, I'm going to note that the buccal mucosa, the palate, the gums, and the floor of the mouth are all moist and pink. There are no lesions or bumps. The patient's teeth are straight, white, and there are none missing. And when her tongue, the forward thrust of her tongue, when she protrudes it, is midline. Okay? So now I'm going to go ahead and I'm going to just assess cranial nerves 9 and 10. So those are the glossopharyngeal and the vagus nerves. So to do this, I'm just going to have my client open her mouth and say ah. And the palate and the uvula should rise, and the uvula should be midline. Okay? And now I'm going to assess cranial nerve 12, which is the hypoglossal nerve. So I'm just going to have my client stick her tongue out. Okay? And when she sticks her tongue out, she's able to maintain that midline position, which tells me that cranial nerve 12, the hypoglossal, is intact. Okay. So now we're going to move on to the neck and the throat. So I'm just going to inspect her neck. So her neck is a pinkish tone even with the rest of her body. It's symmetric. I don't see any rash or erythema. I don't see any bumps or lumps. No swelling. So now I'm just going to palpate for the trachea. I'm just going to turn my little patient around. Okay, just going to palpate for the trachea, which is here. And the trachea is midline. Okay, so next I'm going to palpate for the 10 nodes of the neck. So I think it will be kind of hard to show on the doll, so I'm going to show it myself. Okay, so we have the pre-auricular, the post-auricular, the occipital, submental, submandibular, jugulo-digastric, superior cervical, deep cervical chain, superficial cervical, my bad, deep cervical chain, posterior cervical, and then I'm going to ask my client to shrug, and I'm feeling for the last nodes, which are the supraclavicular. And no nodes are palpable. Okay, so now I'm going to assess the thyroid. So I would have my patient look down and to the right and swallow, and then down and to the left and swallow, and there are no lumps or bumps. So now I'm going to assess cranial nerve 11, which is the spinal accessory nerve. So to do this, I'm going to test range of motion of the neck and muscle strength. I'll do this on myself. So I'm gonna test the range of motion of the neck. Have my client look all different ways. There's no pain. Now I'm going to assess muscle strength. So I'll put my hand here and have the client push their head towards my hand on both sides. Push towards the hand, push back. And there's equal muscle strength, and muscle strength is 5 out of 5. Okay, so now we're going to move on to the thorax and the lungs. So to start, I'm just going to inspect the patient's back physically. I'm just going to turn her around. I'll just have her hold on to the chair here. Okay. So looking at her back, the skin tone is it's consistent with the rest of her body. There's no rashes, lesions, no lumps, no bumps. Not seeing any abnormalities. And now I'm going to just palpate. Oh, her AP diameter is 1 to 2, and her scapulas appear symmetrical. So now I'm just going ahead and palpate the spinous process. I'm going to palpate for bumps, and I'm going to ask the client to tell me if she feels any pain. Okay, did you feel any pain? Okay, so no pain was reported. So now I'm just going to perform tactile fremitus. So when I place my hands on your back, can you just say 99, 99, 99, 99, 99. So vibrations were felt equal bilaterally. And so now I'm going to move on and I'm going to just test her thoracic expansion. So I'll show on me. So that should be, you should have your hands, it's hard to show it, around T9 to T10, and you're just going to ask your patient to take a deep breath in, and expansion should be equal bilaterally. So now I'm going to move on to percussion. So I'm just going to press back. Okay, and percussion, upon percussion, it's resonant over lung fields, dull over organs, and flat over bone. Okay, so now I'm going to just, I'm going to auscultate. Okay, and I'm using the diaphragm of my stethoscope. Okay, and just take a deep breath and I'm going to put the stethoscope. And I'm listening at 3 different levels, and then at the sides. Okay, and I'm going to auscultate in front too. I'll show that part on me. So here, 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 and here. Okay, and lung sounds are clear bilaterally. Okay, so now I'm going to assess the heart. So for the assessment of the heart, I would have my patient at around the 30-degree angle. And I'm just going to start. I'm going to have them look right and left, and I'm going to be looking at their jugular veins. So the external jugular veins, there should be no distension. And the internal jugular veins, light pulsations are normal. Okay, so now that we've done that, now I'm going to just assess the carotid pulses, one side at a time. So the carotid pulses are here. I'm assessing one at a time. And they are +2 bilaterally, and they are non-bounding. Okay, so now I'm going to auscultate for relief. So I'm going to be using the bell of my stethoscope. So I'm going to do this at the angle of the jaw, the mid-cervical, I'll do it on me, and the base of the neck. That's on both sides. So the angle of the jaw, mid-clavicular, and then the base of the neck. Sorry, it's kind of hard to show it on me. No bruits are present. So now going to move on. So I'm going to inspect the precordium area. which is the area over, kind of over where the heart is. There are no heaves or lifts, and I'm going to just palpate, and there are no thrills. Okay, so now I'm going to palpate for the apical pulse, or the point of maximum impulse. It's here. Okay. And it is +2. Actually, no, not plus. This actually feels just barely palpable, but I can feel it a little bit. Okay. So now I'm going to auscultate beat time. So I'm going to be using the diaphragm to start. So we have the aortic, pulmonic, Erb's point, tricuspid, and then mitral. And then I'm going to flip to the bell and do the same coming up. So you have mitral, tricuspid, Erb's point, pulmonic, and aortic. Okay? And S1 and S2 are heard clearly, but there are no extra sounds. Okay, now I'm going to move on to the abdomen. So first I'm just going to lay my little patient down, and I'm going to just inspect the abdomen. So the abdomen is flat, there are no pulsations, the skin color is consistent with the rest of her body. I don't see any rashes, I don't see bruising, I don't see lumps or bumps or lesions. Now I'm going to just auscultate in the 4 quadrants. So I'm going to start with use the diaphragm, my stethoscope, and I'm going to start with the right lower quadrant. So it's hard to see in scrubs, but right lower quadrant, then the right upper quadrant, then the left upper quadrant, and the left lower quadrant. And vowel sound should be normal active in all 4 quadrants. And then I'm going to also auscultate for the arteries. So I'm going to use the bell for this. So the aortic artery should be just a few centimeters above the umbilicus. So probably right here. And then towards the left and the right of the umbilicus should be the renal arteries. And right near that should be the iliac arteries. Okay, and there is no bruit. Okay. So now I'm going to percuss. Again, going over, starting from the right lower quadrant and moving up and all around. So upon percussion, there should be timpani throughout, but over the liver, it should be dull sounding. Okay, so now I'm just going to palpate the abdomen. Again, I'm going to start from the right lower quadrant, move to the right upper quadrant, move to the left upper quadrant, and the left lower quadrant. And do you feel any pain or tenderness anywhere? And the patient denies feeling pain or tenderness in the abdomen. Okay. So now we're going to move on to the musculoskeletal system. So, first I'm just going to inspect the skin once again. So the skin, I don't see any bruises, erythema, no lesions, lumps, bumps, any cuts, any freckling. I didn't see any. I'm going to palpate with the dorsal surface of my hands. I'm just going to feel for the temperature and condition again of the skin in her arms and legs. So she is warm and dry, which is good. So now I'm going to just palpate for her pulses. So we're going to start with the brachial pulse, which is up here. It's right over here. I'm going to do that bilaterally. Then we're going to move to the radial pulses, here and here, and the ulnar pulses. Okay, so I'm going to palpate those bilaterally. And those are all +2 bilaterally. I'm going to move on to the lower extremities. So first I'm going to start with the popliteal, which is behind the knee. I'm going to do that bilaterally in my patient. Then we're going to move down to the posterior tibial, which is right over here. I'm going to do that on my patient bilaterally. And then I'm going to move to the dorsalis pedis, which is kind of out here on the feet, should be like here. I'm going to do that bilaterally on my patient. They're all +2 bilaterally. There is no edema present, which is especially important to look for in the legs and the feet. So that's good. Now we're going to move on. I'm going to test her sensory. So I have this little thing. Okay. So when I'm going to put this on the patient's skin, on their arms and legs area, and I'm going to tell them to close their eyes and tell me if it feels dull or sharp. So close your eyes, please. So she should say dull on her left arm, sharp on her right arm, dull on her right leg, sharp, and just do that in a few places so her sensory is intact. Okay, and now we're going to test range of motion and muscle strength. I'll show you this on me because I don't think my patient can do this. So we're going to see the arms abduct and adduct, the shoulders circumduct, and they can also adduct and abduct. The elbows, they can flex and extend. The wrists can flex and extend and go around and supinate and pronate. And same with the fingers, they can flex and extend. The knee can flex and extend and flex. Legs can abduct and adduct on both sides. I have no pain when moving. We already assessed the neck for range of motion. So now we're going to move on to muscle strength. Oh, and the ankles and feet. Plantar flexion and semiflexion and eversion, inversion, eversion. So now that we've tested range of motion for the extremities, we're going to move to the muscle strength. So my client would be sitting, so I would put my hands here, tell them to push forward, and then I would put here and tell them to pull back bilaterally. And same with the arms, I put my arms here and have them pull towards themselves, and here, and push. And strength should be 5 out of 5 bilaterally, and it should be equal strength. Okay, so now we're going to move on to the neurological assessment. So we're going to first assess the reflexes. I'm going to use my makeshift reflex hammer. So we're going to start with the biceps and the triceps. So I'll show you on me. So this would be where kind of the biceps are, and you would, on yourself, you kind of know what's happening, but you should expect a bit of flexion of the hand. And then triceps, same thing, it's like at the back, and you would do this bilaterally, and you should see the same thing, a bit of flexion of the hand. Then we're going to move to the brachioradial, which is like here, around here. And you should see a bit of probably an extension of the elbow, yes. Then we're going to move to the reflexes in the lower extremities. So we're going to test the patellar tendon, which is like really close, like right under the knee, kind of. And you would expect the leg to go out. Then we're going to do the Achilles tendon, which you want to do, it's down low, and you would expect, it's kind of over here. I don't know if you can see that well. And you would expect the foot to flex. Then you're going to look for Babinski's reflex, where you would, here I can see your foot. So you would run up the foot and you would expect the toes to curl or the foot to pull away. Okay. Now we're going to do a stereognosis test. So I have some items in my pocket. I'm going to tell my patient to close their eyes and to verbalize to me what I put in, what object is in their hand. So close your eyes. So in the right hand, she should say a coin. And close your eyes again. In the left hand, she should say a key. So that would tell me that stereognosis is good. She has the ability to do that. And now we're going to move to graphesthesia. So I'm going to draw something in the palm, or write something in the palm of my patient's hand, and they have to verbalize to me what I wrote. Okay, so I drew a number 8 in her right hand, so she would tell me that. And I drew a heart in her left hand, and she should tell me that. Okay, then we're going to do the Romberg test. So I would have, I'll just verbalize on myself. I would have the patient stand up. I would have one hand in front and behind them, just in case they were to start tipping. And they should close their eyes and just stand tall and straight. And a little bit of swaying is normal, but loss of balance is not. So they should be negative for Romberg sign. Okay, and the last thing we're going to test would be gait. So I would have, let me move this down a bit. Okay. So I would just watch my client walk. Their gait should be smooth and even. Their feet should be moving equal distance every time. There should be no issues. There should be no loss of balance here. I would also tell them to walk heel to toe. Again, their gait should be calm. It should be coordinated. It should be steady. There I would tell them to walk on their tippy toes. Same thing. And their heels. And that would conclude my patient assessment. Thank you.